stay on the phone while our other two speakers talk, and then maybe you could be available for questions at the end.
Sure.
Great. Our next speaker is Representative Nancy Garland. She is the chair of the Democratic House Women's Caucus, and she's also assistant professor at Ohio State University for health policy. So, Representative Garland?
Thank you. We know that women's health issues have become part of the rhetoric, both here in Ohio and across the country. And we all know that women's health is vital to the well-being of our society, not just for us, but for our families, for our children, for our husbands, our significant others. And unfortunately, the Republican House has decided to try to eliminate the Prevention and Public Health Trust Fund. And we know that Representative Boehner actually referred to it as a slush fund. And he also went on to say, I'll guarantee you that they've not spent a dime of this funding dealing with anything to do with women's health. Well, I think what you've heard already here today in terms of our providers and everybody else, this money is going to help women's health. And evidently he wasn't aware that the top 3 causes of death among women are heart disease, cancer, and stroke. The 10 leading causes of death among women ages 18 and older of all races is heart disease, 25%, cancer, 22%, and cerebral vascular disease, 7%. So when we're talking about cutting programs that provide preventive care, this will only result in a decrease in overall health and increase in public and private health care costs, as has been outlined. Elimination of the Prevention and Public Health Fund will negatively affect millions of Ohioans that represent every demographic, especially women and children. We cannot afford to reduce breast and cervical cancer screenings, decrease immunizations, as was just pointed out, and vaccinations, teen pregnancy prevention, and programs to decrease tobacco usage. Cutting prevention programs is a short-sighted, quick-fix solution that will not be beneficial in the long run, financially or in the terms of wellness, because we know that prevention and wellness will ultimately save us money. Early screenings for diseases such as breast and cervical cancer can both save lives and significantly reduce health care costs. Teen pregnancy prevention can help encourage and educate young women on waiting to have children and completing their education. And of course, now we want to have more interest charged on people that are going to college. So really, the Prevention and Public Health Fund provides an investment in the futures of Ohio's women and children. Taking this investment away will only shortchange our future. And the interesting thing is both Democrats and Republicans agree that an increase in student interest rates would be extremely detrimental to college students. We cannot maintain low rates at that expense in well-being of Ohioans. The message is clear. When a portion of the budget is in need of additional funds, the first place to reallocate money should not come from a program designed to reduce the incidence of illness and death among women. Preventive care for women is not a luxury. It should not be taken away in order to close a gap in the budget. And I teach healthcare professionals, and in my class I have 3/4% young women, and when I told them about what was going on, they were just totally amazed that there was an attempt to take money used for prevention, or if they weren't going to do that, they were going to have to pay higher loan rates. And these are healthcare professionals that already have lots of debt, so they don't need to have any more. So I can speak about this from a personal standpoint. Because a woman who wishes to attend college should be able to borrow at an affordable rate without having to sacrifice access to disease prevention programs. Access to education and affordable health care are essential to the vitality of a healthy and productive society.
Thank you, Representative Garland. And our last speaker is Carolyn Casper, who is an advocate in her community, specifically around women's issues, and she's going to tell us what we can do and how we can weigh in.
Even though it sounds that it is hopeless, this is not hopeless. If those of us who are involved and concerned will stand up and speak out, also tell everybody else you know about it, go to the Progress Ohio website, go to the Innovation Ohio website. Is this on here? No.
Innovation Ohio.
Yeah, and you will find ways to hopefully counteract this. It is really short-sighted, as been mentioned before, to attack students and women, pit them against each other. Many students are women. We do let women go to college in the United States now. And there are many of us doing that. I went to school on loans and had children and had help doing that. Without that help, I would not have been able to go. Our society needs healthy, educated people for our workforce and just for our general living arrangements. The citizens need to be healthy, they need to be educated. I have a friend who I was very surprised. I was speaking with her at a conference and I never would have known this. We always think of people as those people over there. In fact, these changes will impact people we know. This person has not had a pap test for 10 years. And when she did go 10 years ago, she did not have a mammogram. She said that she didn't have insurance and would not be able to follow up anyway, so she didn't want to know, which is really not the way to deal with your health. And it also makes it very expensive if you are ill, because by the time you finally know it, it's usually too late and takes a lot of intervention. She also went to the dentist at that time and found out her jaw is disintegrating, but she has no insurance, so there's nothing she could do about it. Nobody in the United States should be in that position. You have to do that. My daughter came home from Colorado. She was working in Colorado for the summer. She was a student in Austin in Texas. She and her husband go to Colorado in the summers and work. They did as students. They got pregnant. They came back to Ohio to have the baby and to work here. He could not find a job and there was no medical care. So he called his father and said, we're pregnant and I don't have a job, we don't have any insurance. And they went to Massachusetts. I don't want that to happen to Ohio. I don't want our people to leave Ohio because they have to go to Massachusetts in order to get something that I feel is a basic right. I think that health care is a basic right. And I find it offensive that they refer to it as a slush fund. The only slush fund is what's going on in their pockets because they're not paying the taxes that they ought to be paying. They need to reinstate those tax breaks, and that would take care of this problem. But I do, again, let me say, this is not hopeless. If we are all willing to stand up and be counted, I think we can stop this awful legislation. Thank you.